there are no questions from in the room, we have a question that was sent in by Mike Stobby at the Associated Press in Atlanta. And he asks, what challenges are they facing on the ground in Haiti today?
That is the million-dollar question. I think the challenges for us sitting here would be impossible to describe, but they are incredibly enormous given the photographs that we have, given the conversations that we've had with our field officers on the ground. When you think that one of our staff could not be identified for more than 12 hours, almost a full day, you think about each family having some similar challenge in locating their children, their family member. It's incredible, and you can see the destruction. When roads are blocked, there's no telephone communication. We're, I should say, very, very fortunate right now that we haven't seen mass disruption of society and civil disturbance. So we've received no reports in that regard. But the challenges are enormous. Yes, ma'am.
Dr. and Ms. Carol Pearson on Voice of America. How do you go about organizing some sort of relief program with respect to health when everything's decimated? You might have the U.S. Comfort, you might have the urgent premium hospital, you might have a few other things, field hospitals. So we're talking about millions of people in the heavily populated area of Haiti. And so what do you do to coordinate this here?
There was a specific question. If you could use the mic if you have other questions, but from Voice of America, about what exactly do you do to coordinate the response. I can describe at PAHO as a technical agency, this is one of our areas of work that is value added, our coordinating capacity. The example that I mentioned with our director convening a conference call of all countries discussing the most effective strategy for the response, because it's incredible, it's extraordinary, the desire to help with the response effort. But you can imagine how that desire might translate into even more chaos and consumption of resources that the people on the ground that are injured need, whether it be food and water, whether you can medical supplies and so on. So that coordination started at 4 o'clock and well before 4 o'clock by PAHO's presence on the ground with its relationships with all the partners and all our member countries in the region. Our building was essentially destroyed, so we moved our operations to a building that serves as a warehouse for vaccines and medical supplies, and that's where currently our staff are operating. We were fortunate as an agency to have telephones. We had satellite phones that were functional. We heard reports from several other agencies, certainly the Ministry of Health, that did not have the benefit of those satellite phones. So we've been able to coordinate and provide our local team with information and support as such. The coordination is a minute-to-minute, hour-to-hour basis that takes place at WHO Geneva, our global partners. It takes place here at the regional level and certainly most importantly at the local level. Another example of how we can coordinate was the offer by Chile to provide a hospital with medical team when we thought that the most efficient use of that offer of support would be to provide medical staff to a hospital that's already functioning and then phase in additional resources such as the hardware components of a clinic or hospital and so on. You can't coordinate support when there's so much uncertainty. So one first step is to try to define exactly what the needs are, and that's what PAHO and a number of partners are trying to do right now. with that assessment, then you can target more efficiently resources.
Do you think that the needs currently are to address trauma injuries, especially crush injuries, burns, and that sort of thing? And then what about in a few days? Are you going to be dealing with tetanus? Are you going to be dealing with, what other things are you going to be dealing with?
Those are great questions, and so the first priority is to save lives, and so that involves the search and rescue, identifying people that have been trapped that still may be alive and getting them out. They will have injuries, so treating those injuries. There will be on a normal day, there'll be a number of births that will happen, and those normal day health events will need to be managed, so that as many women can deliver safely that are currently present. The treatment of, and the approach to trauma you have alluded to, and certainly these medical teams that are coming in have those capacities. When on a normal day there's not such devastation, Haiti has a number of partners, has NGOs, non-governmental organizations, all working together to try to provide health services. But with this sort of major damage, there will be medical specialties required that you don't generally have to the extent required after an event like this. So surgeons, orthopedics, people who are specialists in burn care and so on is being coordinated.
I have another question, if you will. I have heard reports that most of the hospitals in Haiti, some are operating without power, they don't have backup generators, they don't have medicines. Is that your sense of what's happening right there?
Some of those hospitals are handicapped by those issues you mentioned, not having enough generators and so on. So the Dominican Republic and those roads that come in from neighboring Dominican Republic, supplies are being transported. The planes have such provisions. The planes sent from Brazil, for example, and Venezuela. So those supplies are arriving. The question as time goes on is defining the gaps more accurately. Are there other questions from the field? Yes. And for Spanish questions, I'd like to invite Dr. Ciro Ugarte to join me.
Okay, let me do the other English questions first, if I may. Mike Stobby from Atlanta, the Associated Press, also asks, what relief efforts in the past are viewed as success stories, and what would a successful relief mission in Haiti look like?
That's a great question, and I think it has to do with those elements mentioned where a rapid needs assessment leads to a well-coordinated response so that you don't tip the table and impose more adverse consequences than what you're trying to do. So in addition to that, when taking immediate action, that all partners have that long-term vision, that this is today, and certainly saving as many lives today is important, but as we work through this disaster, having a long-term vision on what the health system could be like, those safe hospitals and so on during the reconstruction period.
Yes, and I would like to just go back to diseases that you could expect that you might want to try to manage. Given the fact of, you have to look at where Haiti started, what percentage of Haitians would be up to date on the tetanus shot, for example? What kinds of diseases are you expecting to see that, and with a coordinated response, try to minimize or prevent?
Great question. With the disruption in the water supply, certainly waterborne diseases, and which is why I mentioned diarrhea, would be diseases important to try to prevent and control with safe water and sanitation. Respiratory diseases, you think of outbreaks in crowded conditions like this with homeless people living in crowded, what little shelter there is, the spread of respiratory diseases will be important. We know that it's been a challenge to maintain high levels of vaccination coverage in Haiti. So there's already a risk for outbreaks of vaccine preventable diseases. You alluded to tetanus, but certainly we would be very concerned about diphtheria, for example, which tends to reemerge when coverage levels are low or when the system is stressed. So measles is a common example of an outbreak that can occur from a disaster such as this. But I think the major focus will be the prevention of diarrheal diseases, the prevention of respiratory diseases, the link to trying to reinforce and prevent vaccine preventable diseases, because that's why they're called preventable. They can be prevented.
Normally when you talk about disaster relief, you coordinate with a country's government. But here, the government, the whole parliament building and even the president's palace has been destroyed and decimated. And so are you taking over for the government until that government can function once again in terms of health?
I would respond to that question by sort of first taking a step back. The Pan American Health Organization is an organization of the countries. It's not an organization of me as deputy director or anybody in this room as technical advisors. It's an organization of the countries. We serve as secretariat to make sure that the organization is efficiently coordinated, it runs well. So with that, then, PAHO typically works in countries in the Ministry of Health. That's where we spend our time. We are part of the team of the Ministry of Health. Our advisors work, live, and breathe and eat with their counterparts in the Ministry of Health working on public health issues. So given that background, then, when this happens and someone cannot participate, whoever's there will, to the extent possible, fill the gaps. And that's what we're doing now. And as soon as we can bring in and communicate efficiently and effectively with the Ministry of Health, they will ultimately take over. That's their country. But in this dire hour of need, that we will fill the gap.